yeah, go ahead.
Are we stopping
Once you get two positives. Yep, two positives, stop. No reason to cause them more pain. You have a sinister look on your face. Oh man, you want to keep going, don't you? Oh, got it. Okay, it's okay. So, nope, straight. So those ASISs you palpated, you're going to get on the anterior side, anteromedial of each side, and we are going to be pushing outwards. And we're going to hold. Good job relaxing.
So we're just kind of like hooking.
Yeah. If anything, it'll be more sensitive underneath your heels. And you have to push hard. He's probably thinking, I'm not pushing that hard, but I'm trying. He's trying not to tense up. Good for you. And you go for about, if it's irritable, you expect it to be painful faster, but you can hold it up to 30 seconds. The reason it's called a distraction test is it's distracting the front of the anterior SIJ. So, anterior SIJ, posterior SIJ. So we are distracting the anterior SIJ. So you can have pain because we are shearing the front, it's compressing the back. When we do the compression test, good, don't want it to be confusing. Now we're going to be compressing the front, distracting the back. So just be aware of that.
So it's in relation to the anterior SIJ?
In this test, yes. So when we say distraction test, it's distracting anteriorly. When we say compression test, it's compressing anteriorly. And the other test is just the reverse.
Are you using shear and distraction synonymously?
Yes.
Okay, just make sure.
Because one's a distraction or a shearing force that's opening,
Okay.
and then the other is compression. So that is that. So anterior SIJ distraction. So that we got a negative, but if we had one more positive, we would go into this test next. This is also a shearing test.
Wait, what was the other one that was positive? You said?
No, we didn't do any other one yet.
Okay.
If we get another positive, you would stop.
So, but you said there were only two.
Don't what? Only two positive.
You get positive.
No, he was negative. He didn't have pain.
Oh, okay. You're just saying that if this was positive,
You would need one more, and then that's it. Okay. Thigh thrust is a shearing test. You can use a towel or you can use your hand. Be careful with handling on this one because you're putting your hand in certain areas that could be awkward. So it's okay. I'm a professional. So when you do this, you could either put a towel on their sacrum, so you would just roll, put a towel roll, done. Or otherwise, you're just using your hand. My hand is going to be on his sacrum. Let me see that, Mom. No, this. So hand is going to go here so that I can take his right SI and I'm going to go through the hip and push it backwards to shear this over my hand. So, and good. So hand is there. You want to make sure you're not in the butthole. So make sure you're up.
I don't know what you're not.
So now I'm on the sacrum. The SIJ is available for motion. Now we're going to just flex to 90 degrees. We're going to put some pressure down, and then we're going to thrust.
So
Not expecting it.
Oh, we were just doing a distraction.
Thigh thrust.
That's why you don't put it in.
I'm on the wrong slide.
No, my hand is on his sacrum, so basically on the right,
you're creating.
because I'm on his right leg. So Alden is right here, right? So this is his right SIJ. So my hand is right here so that his right SIJ can shear over my hand. It's like pistol grip, right? What? Yeah, your pistol grip in the SI. Minus the pistol part. Do flat hand. Do it again. See?
No, I looked down to finish writing my note, and then everyone was like,
It was too fast. I know, right? All right.
You don't need
Sorry,
to do
It's only position.
because it's not a.
And then we just load up the hip and then straight down the thrust. It doesn't hurt.
No, that's fine.
What will the patient when you've done that on somebody and they've been positive? Is it I'm nervous? Would they would they jump up? Would it be something like that?
I mean, hopefully not jump, but
Like they would. It
it's a
would be
pain
like
provocation test. Yeah, it would hurt.
it would be like sudden when you did this. It wouldn't be like thrust and then like oh like now it's coming, now it's coming.
No, it would be a sudden.
Thrust. Okay, got it.
Yes.
Don't forget about it. You watch that video.
No, this is no. You never use it as intervention. They only call it that because you're thrusting the thigh. Otherwise, it's just a simple shear of the SIJ.
So you don't have to go to like and
No, I did. I loaded up his hip. That's as far as it went as I axial loaded. And so if his hip is loaded, the only thing left then is the pelvis. So since I'm blocking the sacrum and the pelvis is doing the motion, the only thing that's capable of moving is the SIJ. Yeah, no, you could just take a towel and put it there. It's fine.
I get it. You're creating space for it to actually drop off.
It's a fulcrum.
Yeah.
So pretty much if the test becomes it's positive for pain, doesn't tell us that we know what's going on. It's just
It just tells us the SIJ could be a source of pain. Yep. Which is why this stuff gets a lot of flack. But maybe your patient comes to say, I've had this SIJ issue for so long, and my doctor wants to give me an injection. Well, if you have all these pain provocation tests are positive, you ruled out the hip, you ruled out the back, you can say, yep, it's an inflamed joint causing you pain. That would be great to get the injection. That'll help a lot.
What happens